Just going to go through a couple of stats. You don't need to memorize this at all, but the important thing is that it goes up and to the right. So this is our total national health expenditures over the course of years. So 1970 looks like we're spending like 100 billion, and now 2015 we're up at about 3.5 trillion, and it's estimated that by the end of 2019 it'll be about 4.5 trillion. Just this year. This isn't like accumulated over years. This is just this year. So that is a lot of money. And if we're spending a lot of money, maybe we feel great, right? No. So this is the percentage of Americans that have been diagnosed with diabetes. Again, you can see it up and to the right, 1970 to 2019. We're about between 9 and 10% of the population being diagnosed with diabetes. And I want to emphasize that these are diagnoses. These are not the estimated 84 million Americans that are said to have pre-diabetes. So if we included them, this would go straight to the ceiling. But you can see that this is advancing. Has anybody been diagnosed or has a friend or loved one that's been diagnosed with pre-diabetes? What do they tell you? What did they tell you? Any?
Just come back and check.
Come back and check. And then when you have diabetes, we'll give you a medication to take care of that. But there's very little effort to go backwards, right? It's like once you get the disease, then we know what to do. These are cancer deaths. Again, just, we can see the increase over the years. Estimated cancer death rates in 2019 are going to be about 607,000. The good news is that the World Health Organization has estimated that about 1/3 of all cancers could be prevented or reversed with lifestyle changes. So we'll talk more about that, but I actually think that's a conservative estimate. I think it's probably more than that. But we'll touch on, action steps in a little bit. And then this is just chronic illness in America. So chronic illness meaning nothing acute, not an acute infection, not an acute disease. This is something, like I mentioned, the heart disease, diabetes, Alzheimer's and things like that. So again, projected to just keep on going up. So we're spending a lot of money and we don't feel that great. But maybe we're just happier, right? Like maybe that's, maybe we're feeling good in like what we're doing. Maybe we want there's our antidepressant use in America. So, maybe we're thinking like, oh, just let me eat my pizza, wings and, beer and use my technology and sit on the couch because that brings me joy. No. This is the antidepressant use in America. So we're close. And this only goes up to 2014. But we're about 13% of the population using antidepressants. So we're spending a lot of money. Our health isn't that great. We're not all that happy about it. But what about the kids, right? Like the kids are probably fine. They're young, they're our hope, they're our future. Here's the autism rates of US school-age children. So in 1975, we were about 1 in 5,000 kids were diagnosed with autism, and now we're up to 1 in 59. And it is more prevalent for boys than girls. So boys are about 1 in 42, and girls are about 108, 1 in 189. So if you think about that, so let's say go back to the average, which is 1 in 59. The average school classroom in Southern California is about 20 to 30 kids, right? So if 1 in 59 are being diagnosed, that's 1 in every third classroom that's being affected. And if you have, anybody in your family that is affected by autism, you know that it doesn't just affect the immediate family. It doesn't just affect that teacher, that classroom. It really is spreading, around our community. In addition, they've done testing on infant cord blood and blood testing, and they found 287 chemicals in newborns. So they're not even coming out, as, with a clean slate, right? So there's definitely something. And out of those 287 chemicals, 180 have been known to cause cancer in either animals or humans. So. And these are things like mercury, like Teflon, like fire retardants are being shown in blood samples of newborns. So here's just a few more whys. Again, like no reason to memorize everything, but Only 6% of Americans consistently engage in the top 5 health behaviors. This is nothing crazy. This isn't like I add superfood smoothies every day, or I do CrossFit 6 days a week, or I meditate for an hour. This is things like maintaining a healthy weight, not smoking, not drinking in excess, not even not drinking, just not drinking in excess, getting enough physical activity and getting enough sleep. So about 1 in 15 Americans is doing something like this. Or I'm sorry, less than that. In 2018, the average life expectancy in the US dropped to 76.3 years, and now we're 27th as far as life expectancy among other countries. And I don't know about you, but I've heard for like years now, like, you know, we're coming up on the generation that's gonna live less than their parents. We're there, we're getting there. So that's definitely something that should be alarming. In 2017, 79% of the adult population had sought medical assistance from a healthcare professional in at least a year. And that's just to say, like, this is really affecting all of us. The average American sees 19 different physicians and specialists throughout their lifetime. So gone are the days where you have one doctor all of your adult life. You're often sent to specialists and another specialist and another clinic and another doctor, and you know, and it's really hard to manage that amount of information. In a recent survey, it was found that 85% of people feel frustrated or helpless after a doctor's appointment. I mean, I would too if I spent 10 minutes trying to get, you know, cram my whole life story into, you know, that amount of time, and then I left with maybe a to-do list, but very little action items. In 2016, almost half the population had used at least one prescribed drug in the past 30 days. So half the people here, theoretically, have used a prescription in the last 30 days. It's been estimated that a minimum of 30% of antibiotic prescriptions are unnecessary. I've been a target of that, and I don't say target meaning that it was intentional, but they don't know what's wrong with you, so why don't you try an antibiotic? And now all this information is coming out about how antibiotics can affect the gut microbiome or the gut flora or the health of your digestive tract. So not only are they giving it now in many instances and it's not helping, but it's actually detrimental. And 2,000 physicians interviewed by Johns Hopkins said on average 21% of healthcare is unnecessary. So all that to say is that what we're doing isn't working. You don't have to be a statistician, you don't have to be a medical expert to understand that all those graphs going up and to the right, all those statistics, and what we're doing just isn't working. We're spending a lot of money. We're not feeling that great. We're not all that happy about it. It's affecting our kids as well. You'd think for that amount of money, we should feel mind and body healthy. Our kids should be succeeding, but we're not. So where's the disconnect?